Hello everyone and welcome to my channel. So today I'm gonna discuss about few topics that is so base that most common questions will be asked from those topics. And today take I'm gonna study about the psychiatry, and the most common topic is schizophrenia, and in that we discuss about typical and atypical antipsychotic drugs. So we will study about today antipsychotic drugs. So basically our brain is responsible for normal functioning. Few transmitters are responsible for the normal functioning of brain, and there are total three neurotransmitters that is mainly work on our brain. So these are acetylcholine, serotonin and dopamine. So when schizophrenia is caused by increased dopamine level, so we used to give antipsychotic drug to decrease the dopamine level. So serotonin, this schizophrenia is caused by increased dopamine level, and decreased dopamine occur in case of Parkinson disease, and decreased acetylcholine level in case of Alzheimer disease. So antipsychotic drug uh, are of two types: typical and atypical antipsychotic drug. So which one is the better one for the psychosis? So it is considered that different two types: typical and atypical antipsychotic drug. The atypical antipsychotic drug are better than the typical one because it doesn't cause extrapyramidal syndrome, because whenever we are giving the antipsychotic drug, it is responsible for causing the EPS, which is like extrapyramidal syndrome. So what the typical antipsychotic drug will do, it decrease the dopamine level. So they are the strong dopamine blocker. So they will block the dopamine level, and if they will block the dopamine level, then there will be a more involuntary movements, because it will act on the extrapyramidal tract, and extrapyramidal tract is responsible for the involuntary movements. So if we are giving the typical antipsychotic drug, it will decrease the dopamine level, which is responsible for involuntary movements. Then involuntary movements will lead to EPS, extrapyramidal syndrome. So typical antipsychotic drug includes haloperidol, that is the most common and the strongest dopamine blocker, and the weakest one is thyroidazine. And CPZ is the most old one, typical antipsychotic drug, that is the first drug discovered, chlorpromazine. And on the other hand, the atypical antipsychotic drug includes clozapine, olanzapine, risperidone, and quetiapine. So this clozapine is the most common, and as you all know, in most of the schizophrenia case or psychosis case, we give the clozapine because it doesn't cause extrapyramidal syndrome. So now we have discussed about typical and atypical antipsychotic drug. So if we are giving the clozapine to the patient, so what all the things that we have to consider? The side effect of clozapine includes agranulocytosis. So we have to check whether the WC count is in normal range or not. If it is less than 3,000, we should not give the clozapine drug. So the normal WBC count is 4,000 to 11,000, and this clozapine is responsible for WBC count. The maximum, which is the drug which causes the maximum EPS, that is the haloperidol, because it blocks the dopamine level, and the minimum EPS is caused by the thyroidazine. And now the next our topic is, what is EPS? Now now most of the questions will come from the EPS. EPS is basically extrapyramidal syndrome. Extrapyramidal syndrome includes basically four major disease condition, that includes first one is acute dystonia. First one is akathisia. Akathisia is irresistible urge to move from one place to another, like patient can't sit at one place, that is akathisia. And this is the most common. If we ask about the most common extrapyramidal syndrome, that is akathisia. And the earliest symptoms, if we ask about the earliest EPS, that is acute dystonia, muscle dystonia. In this there will be muscle dystonia. It will be a rolling movement of tongue will be there, and torticollis will be there. Patient head will be at one side and the chin will be on the other side. Then the late EPS is tardive dyskinesia. In tardive dyskinesia, what will happen is it includes the involuntary movement of lower face. So there will be chewing movement will be there, and there will be protrusion of the tongue. Then the fourth one is NMS. That is the most common. Is the neuroleptic. Most common is akathisia. NMS is the neuroleptic malignant syndrome. In this, it includes malignancy means malignant means malignancy. Syndrome is group of disease. So there will be a group of disease, and it will basically includes exothermic, like heat generation will be there. Patient will complain of fever and other fever and rigidity. So these are the four major EPS: akathisia, muscle dystonia, then we have this tardive dyskinesia, that is a late stage one, and then the fourth one is NMS, neuroleptic malignant syndrome. Now, what is the drug of choice for EPS? So, if drug of choice will be anticholinergic drug. So, we will stop the haloperidol. We should not give the haloperidol. We have to stop if patient is complaining EPS, we should stop haloperidol and start anticholinergic. That is THP. Most common is THP. This is trihexyl phenydyl, and another one is benzyl hexol. So in acute psychosis, like for a longer acute means for the long term psychosis, we used to give haloperidol, and it is also a drug of choice for acute mania. So in olanzapine, the side effect includes the weight gain. In risperidone, we have to check the ECG and the BP because it is responsible for postural hypotension. And clozapine, I have already discussed that it will cause granulocytosis. So this one is for major topics: antipsychotic drugs, psychotic drugs, and EPS. In another video, we will discuss about the other major topics.